If you suffer getting through a meal, it could be more than indigestion. It could be diverticulitis. And Dr. Andrew Ross of Boca Raton Regional Hospital joins us to tell us more about this condition. First of all, doctor, thank you so much for joining us.
Hello.
What is diverticulitis?
Diverticulitis is an inflammatory process of the colon, mostly of what's called the sigmoid colon.
And the symptoms associated with it when we're talking about this condition?
Symptoms can be cramping abdominal pain, fever, chills, and sometimes a change in bowel habits.
So perhaps there's some people watching this out there. Okay, do I have this? Does it run in my family? Does it run in families?
There's no real link, although we do see it frequently in families.
Okay, all right, possibly. What are some other risk factors? I mean, if it's not hereditary, what are some risk factors?
Well, the two acknowledged risk factors are obesity and smoking.
Okay.
Chronic constipation also can lead to diverticulitis.
Okay. As a doctor, you surely diagnose this. What do you particularly look for? How is it diagnosed?
Well, the usual diagnosis is made based upon the history from the patient, the location of the pain, the type of pain. It's often associated with fever, chills, and the tool that we use most nowadays is a CAT scan of the abdomen.
Okay. Interesting, interesting. After the diagnosis comes the treatment. What treatment options are out there?
Most patients can initially be treated as an outpatient. Usually it's diet modification to something like a liquid diet for a few days and oral antibiotics.
Could this be a chronic condition, or is it once it's treated, it's gone? Talk about that, please.
It's often a chronic condition. It can be something as simple as an outpatient treatment and something as catastrophic as emergency surgery, but many people have recurrent episodes of this over time.
You know, we talk about prevention during these segments. Will a person that's diagnosed with diverticulitis, do they really need to change their eating habits and health habits in general?
Generally speaking, yes. Obviously, stopping smoking and weight loss would be paramount, but in addition to that, a high-fiber diet, plenty of fluids in their diet, and exercise.
The smoking in particular, that can lead to this. What is
well,
the
it's associated with diverticulitis. Patients who do smoke seem to have a higher rate of diverticulitis.
Interesting. Okay. Well, doctor, thank you so much for the advice. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.